Good afternoon, everybody, and thank you all for joining us this evening for this military match ceremony. Congratulations to all of the military students, as well as their families, friends, and those who were able to support them through this journey. I'm very grateful that we can all be together this evening, even though not in person, virtually. It's a genuine honor and pleasure to be able to celebrate with our students and their families and friends. At this time, I'd like to welcome Dr. Richard B. Homan, President, Provost, and Dean of the School of Medicine. Dr. Homan?
I want to welcome everyone, family, friends, and especially the students that are we're celebrating their congratulating them on their match this year in the military match. This is just really special. Forward to participating in this each year over a dinner and having the opportunity to see family, friends. There's often an extended family that have connections with the military among the students that are matching. And we always have a good time congratulating the parents and friends and giving them high fives on the incredible accomplishments of the students that we're celebrating tonight. So instead of doing that personally, we're doing it virtually, but I assure you that we have a lot of pride in the students' accomplishments, as you all do as family and friends, and we jointly join you in congratulating their accomplishments. As you know, this match for the military match is a little bit different than the civilian match. That will be coming out in March and spring of this year. And the early match for the military match provides an opportunity for us to have this special and more intimate celebration for those individuals that are entering the Navy and Army this year. As you know, the three armed services have medical corps, the Army, Navy, and Air Force. Today we have students in the Navy and Air Force that will be celebrating their matches. And it's very competitive. I just wanted to make it clear to everyone that the civilian match, there are many, many positions, many students that are applying for that, but it's even more competitive in the military match because of the number of students that are competing against a limited number of positions. So again, I want to congratulate the students. Here at EBMS, as you know, we have a strong interest in serving the community. Our vision is to be the most community-oriented school of medicine and health professions in the country. And we try to train our students not only on how to be a great physician and clinician, professional, but also understand the community in which we serve. And I'm a physician and feel as if it's been a privilege for me to be a physician in medicine, which I believe is the most noble professions of all, especially being a physician in the United States. And for physicians to go into the military, you're the most noble of our group because you are sacrificing and serving our country and finding ways to serve not only our community here, but the global community, and to protecting our warriors, provide opportunities to be able to improve the health of those that you'll be touching across your career. So we can't be more proud of you for the work that you've done and will do, and provide opportunities to be role models for other medical students, residents, and clinicians in the years to come from the outstanding careers and experiences that you will have during the course of your career. You're going to make a difference, a big difference. And we're very grateful for your sacrifice and your commitment for joining the armed forces. I know Dr. Conran has served, Dr. Hooper has served. I was kind of in a quasi-commissioned corps of the Public Health Service, which really doesn't count. My dad was a Joint Chiefs of Staff in World War II, and he always thought that I was part of F Troop and not really in armed services. But I understand the service. I understand the commitment. And I want to just have a special congratulations to all of you for making that special commitment to serving and protecting our soldiers and our nation. I can't think of anything more noble than that. So as we celebrate your accomplishments tonight, I want to also reach out to your families to thank them for the support that they provided to each and every one of you along the way. I want to just say on behalf of all our faculty, we can't be more proud of your accomplishments, and we want to wish your congratulations tonight and our best wishes for you in the coming years as part of your career in our armed forces. So thank you and congratulations. At this point, I'd like to turn it back to Dr. Flenner for some remarks, and then he will also introduce our other speakers. Dr. Flenner?
Dr. Homan. I too would like to take a moment just to offer my congratulations to this fine group of students. You have really kicked off the match season at EVMS with a bang, a phenomenal match that you had this year. So congratulations to you all. I am also from a military family and ended up in Hampton Roads area like many individuals who had an affiliation with the Navy. So I'm very familiar with the sacrifices that you all will make as military career professionals. And I completely respect the decision you've made, and thank you very, very much for the commitment to not only our nation, but your fellow service members and our veterans. It goes without saying, it's been said many times this year, how unprecedented it has been with all the challenges. But throughout that, your perseverance, your hard work has certainly paid off. Again, that is represented in this very successful match this year. And I wish you nothing but continued success in your careers, and also know that you will continue to make EVMS proud wherever your career takes you. So my heartfelt congratulations to you all. At this time, I'd like to introduce Dr. Conran to make some comments. Dr. Conran?
Dr. Flanner, thank you and to our students, thank you for inviting me. First of all, to our students, congratulations on your GME selection, and thank you for your commitment to actually serve our nation's best. You know, putting politics aside, you guys are entering a career where your role is to provide health care, often life-saving health care to our brave, selfless soldiers, sailors, airmen, and Marines that put their lives in harm's way. There's no doubt that your GME experience will prepare you for that role, in addition to taking care of dependents and individuals like me who are retirees. You know, some of you may leave the military after your commitment is over. And again, I want to thank you for serving. However, some of you may decide to make the military a career. In my 30 years on active duty, I found it a very rewarding experience with numerous opportunities for professional growth. But the thing I want you to remember, and everybody in our audience, is most important is the population that our students will serve. That population is selfless. Now, I recall my experiences when I was a clinical skills facilitator at Walter Reed and Bethesda Naval. Many of our service members that we saw when we were interviewing patients had been in combat, had been injured. Some of them lost their extremities due to IEDs or improvised explosive disorders while they were deployed in the Middle East. Now think about this. If you were injured, maybe had lost an extremity due to combat, what would you ask your treating physician? Most individuals might say to their doctor, will I get better? When can I go home? But the answer that our students received is, when can I go back to my unit? You may have heard the term brothers and sisters in arms. Our service members are a cohesive, altruistic group that put their lives on the line. Your role as healthcare providers is to ensure that you provide them with the best healthcare possible. One of the things that you'll come to realize is that there's a difference between practicing medicine in the military and military medicine. There is no doubt in my mind that EVMS has prepared you to enter your respective GME programs. Military medicine is different, however. Medical school does not prepare you to be a flight surgeon or an underwater sea expert or a special forces doctor. Surgery in a hospital is very different from surgery on the battlefield. These are unique roles that only the military can train you for during your career. Take advantage of them. There are also research opportunities in the military that are unique, such as biological and chemical warfare, tropical medicine that you may wish to pursue. One of the things that is important is physician well-being. Part of physician well-being is financial well-being. In contrast to a lot of your peers, you are very fortunate. There's no student debt. You will have free health care. You'll have free life insurance. You'll have a housing allowance, and the military will pay you to move from the Hampton Roads area to your respective station. You know, one of the ways that people deal with stress is by exercise. Believe me, having gone through it, the armed services will ensure you exercise through their semi-annual PT test. Actually, many GME programs provide time for residents to work out together, which will build strong, long-lasting relationships. One of the things that you should consider while you're on active duty that you may not appreciate now is that experience that most physicians encounter after they leave the service has been a very positive experience. I know in my career, spending 30 years as a pathologist in the military, it has been very positive. I've had a lot of opportunities. Again, many employers prefer hiring military physicians over their civilian counterparts. Let me encourage you that over the next 4 months, prepare for your new careers. Again, you're going to have to work out athletically besides working out, making sure that you're in compliance with the military's height and weight standards. Consider rotations that are beneficial to the patients that you will take care of. There's no doubt that military training is challenging. Injuries occur every day. If you can, consider sports medicine and trauma rotations before you graduate. Based on the fact that our military deploys throughout the world, also, you should try to have an appreciation for infectious disease. So if there is an opportunity to take an infectious disease elective before you graduate, I would highly recommend it. Again, regardless of where your career takes you, EVMS is proud of your decision to serve in the armed forces. Again, good luck and congratulations. At this time, what I'd like to do is invite Dr. Flenner, as well as our military students, to announce their residency matches.
Thank you, Dr. Conrad, for your perspective. At this time, it's my genuine honor and pleasure to introduce in alphabetical order our amazing military graduates for the class of 2021. Each student will have the opportunity to share their match results with us. So we'll begin with Jessica Corder, U.S. Navy.
Hi, everyone. I'm so excited to be at Portsmouth for internal medicine. Thank you, Mom, Dad, and Matt for your support in helping me make this happen.
Congratulations, Jessica. Next, we'd like to introduce Christian Go, U.S. Navy.
Hey, everyone. I'll be going to Portsmouth for emergency medicine. Want to thank my parents, my siblings for all the support they've had, and mainly my classmates too, just going through medical school together and now serving in the military. So thanks.
Congratulations, Christian. Next, John Hardy, U.S. Army.
Hey, everyone. I'm really excited. I'm going to be training at Brooke Army Medical Center in San Antonio for internal medicine. I wanted to thank my family for their support and for coming today.
Thank you and congratulations. Next is Alice Kistanev, U.S. Navy.
Hi, everyone. I matched in psychiatry at Naval Medical Center, San Diego. I want to thank my husband, Sean, my mom and dad, Dr. Derber, Dr. Hooper, and Dr. Knight, and all of EVMS faculty and staff, as well as my classmates. Congratulations.
Thank you. Congratulations, Alice. Next, I'd like to introduce Jeremy Kernot, U.S. Army.
Hey, everyone. Thanks for coming tonight. I will be training at Duke University Medical Center in urology. Just want to thank my parents and my family for all the support over these last few years. This accomplishment is as much yours as it is mine. So thanks.
Congratulations, Jeremy. Next is Ethan McGann, U.S. Navy.
Hey, everyone. I'm Ethan, going into otolaryngology at Portsmouth Naval. Excited to be here in Norfolk some more. Big thanks to Mom and Dad for laying the groundwork for my successes. And huge thanks to my wife, Katie, for her constant love and support for the last 4 years. Couldn't have done it without her.
Congratulations. Next, I'd like to introduce Alexandra McNally, U.S. Navy.
Hi, everyone. Thank you so much for coming to our event tonight. I want to start out and thank my family, my friends, the faculty, and my beautiful girlfriend, Madison, for all the support over the last 4 years. I matched general surgery at Naval Medical Center, Portsmouth. So excited to stay locally for at least another year. Thank you very much.
Congratulations. Next, Alexander Metzger, U.S. Navy.
Hi, everyone. Thank you for coming. First, I'd like to thank my parents and my brothers and all of my classmates who've been with me throughout this whole process. And I'm glad to say that I have been selected for civilian deferment for a residency in anesthesiology.
Congratulations, Alex. Next is Bradley Eulis, U.S. Navy.
Hey everyone, thank you very much. I matched in internal medicine in San Diego. I would very much like to thank my family and my parents. I would also like to thank my wonderful wife, Courtney, and my roommates, as well as my friends and those people who have supported me throughout medical school. I couldn't have done it without you. Thank you.
Congratulations, Bradley. And next, Jasmine Williams, U.S. Army.
Hi, everybody. I matched in emergency medicine at Brooke Army Medical Center in San Antonio. I just wanted to thank all my friends and family. It truly took a village to get here, and I'm greatly appreciative of all of you. Thank you so much.
Congratulations, Jasmine. Congratulations to each and every one of you. Again, what a fantastic group of individuals with very impressive match. So heartfelt congratulations to you all. At this time, it would have the pleasure of inviting and introducing Dr. Brooke Hooper, phenomenal colleague and individual who can share some closing remarks with you. Dr. Hooper?
Hi, everyone. It's such a pleasure and an honor to be part of this ceremony and this time with you. I just want to thank you for your service. I've had the opportunity to work with a lot of you very closely, and I'm so proud of everything that you've accomplished so far. Soon it will be time for you to continue your training as residents in hospitals across the country. You'll be caring for patients who have served our country. You'll face obstacles along the way, but knowing all of you, please know that we believe in you and you should believe in yourself. You have the tools and the training to make a huge difference in people's lives and in our country. You are mission ready, and as one of your advisors, I really want to hear about your accomplishments and the places that you go on this journey. One day you might be in my position and have the opportunity to be someone's coach as well. Just value every member of your team and help them develop to their greatest potential. It's truly been a privilege and an honor to work with each one of you, and I can't wait to see what you all accomplish in the future. So that concludes tonight's program. Congratulations once again to all of our military students, and thank you all for joining us.